Hello everyone, I am Dr. Roshan, Surgical Oncologist, Malnad Cancer Hospital, Shivamogga. This month, as you all know, October is celebrated as a Liver Cancer Awareness Month. Now, so I will be talking briefly about the liver cancer. Now, why do we have to celebrate a month on awareness of liver? The issue is, the liver cancer is the sixth most common cancer in the world, but third most common cause of all cancer deaths in the world. Even in India, it is one of the most major cancers prevalent both among males and females. In India, male to female ratio is almost 2:1. That is, for every two males, one female is also affected. The total incidence of liver cancer is high in Northeast India, that is in the region of Mizoram, Nagaland and Assam, followed by South Indian states of Karnataka, Andhra and Tamil Nadu. The incidence is so high, it is almost around 5 to 7 male patients in a lakh population and 1 to 5 female patients in 1 lakh population. There are actually two types of liver cancer, that is, one is a primary liver cancer which is called as hepatocellular carcinoma, other is secondaries in the liver, that is the disease which has spread to the liver from the other organ. But today we will be concentrating only on primary liver cancer, that is HCC. Now, to give you a wide picture, HCC is most common in a cirrhotic liver, that is, the livers which are damaged by the other condition. So, the prognosis of the patient is also very poor, since not only the cancer but the liver per se is already damaged, is of a low function. I will talk about the brief symptoms. The presentation of hepatocellular carcinoma is usually in a very non-symptomatic or very vague symptoms like abdominal distension, abdominal pain, swelling, vomiting, weight loss, weakness, early satiety, that is feeling of early fullness after taking food, or jaundice, or maybe in the advanced stage like which presents with hematemesis, that is vomiting of blood, bone pain, or respiratory symptoms like breathing difficulty caused due to the large increase in size of the liver, or the pleural effusion, that is collection of the fluid in the pleural cavity. Other than these, it can also present with paraneoplastic syndromes, that is, those are the syndromes which are caused by the loss of the liver function, that includes hypercalcemia, hypoglycemia, hypercholesteremia, and hypererythrocytosis, or changes in the sexual characters like gynecomastia, that is development of a male developing breast, or precocious puberty, that early onset of puberty, or change in their sexual characters. Now, coming to the how do we investigate for hepatocellular carcinoma? The investigation is very simple, that we do a blood test for alpha-fetoprotein, which is a tumor marker for hepatocellular carcinoma, and viral serology for hepatitis B and hepatitis C, and liver function test. And then followed by imaging modalities like ultrasound abdomen, CT scan abdomen, or MRI abdomen, depending upon the stage we are expecting. We can even get a PET scan to rule out the metastatic disease. After getting the investigation done, if the image shows more than 2 cm tumor, or alpha-fetoprotein and alpha-fetoprotein more than 200 microgram, then there is no role of biopsy, which is be confirmatory for hepatocellular carcinoma. If the lesion is less than 1 cm and CT scan doesn't show the characteristic features of hepatocellular carcinoma, then the patient can be kept on follow-up. Now, coming to the staging of the liver cancer, as we all know, all the cancers are staged according to the TNM classification, that is, tumor size, number of tumor, and nodal disease and metastasis of the tumor. But in liver, along with TNM classification, we have other staging modalities like CLIP and Okuda staging, because here not only the tumor per se, but general characteristics of the patient as a more important role in giving the prognosis of the disease. Coming to the prognosis of the patient, it has been noted that the tumor with less than 2 cm in size and no vascular invasions have a very good prognosis. But if the tumor is more than 2 cm or showing vascular invasion, associated with the poor prognosticators like hypoalbuminemia, hyperbilirubinemia, and ascites, tend to do very badly. Coming to the treatment modalities in hepatocellular carcinoma management, all of them are dependent upon the liver condition of the patient. That is, if the patient is already having a very bad cirrhotic liver, then the options are very minimal. There are many modalities of treatment that include surgical treatments, which are either hepatectomies or transplant, or localized modalities of treatment like radiofrequency ablation, microwave ablation, local installation of ethanol or acetic acid, or even local chemoembolization or chemoradiation. Now, coming to the surgical management of the patient, it all depends upon the general condition, which is decided by child Brooks criteria. If the child Brooks criteria of the patient is A, then the patient can be subjected to hepatectomies, which are either can be a local non-anatomical resections or anatomical resections depending upon the size of the tumor. If the tumor is less than 5 centimeters, less than 2 centimeters, then the non-anatomical resection with a 1 centimeter margin can be done. For 5 or more than 5 centimeter tumors, then the patient has to undergo hepatectomies, anatomical resection, either right or left hepatectomies or extended hepatectomies depending upon the extent of the tumor spread. But for the hepatectomies, the general non-malignant liver has to be in a very good shape. Now, if the child Brooks criteria of the patient is B or C without any meds, then the patient is a subject for liver transplantation. Since the liver is already damaged, there is no role of removing a part of the liver and leaving the non-functional liver behind. So, we subject the patient to total liver transplant. With the good liver transplant, the patient tends to do well. Once the patient is not a candidate for surgical resections, then we subject the patient to what is called as local ablative therapy, where we try to destroy the tumors with the intact liver. These are either done by injection of ethanol or acetic acid, or radiofrequency ablations or microwave ablations. The indications for these are usually less than 3 centimeters tumor, which are less than 5 in number, which are quite away from the vascular structures adjacent to it. Other than this, we can subject the patient to what is called as transarterial chemoembolization, where we inject a chemotherapeutic drug into the vascular tree of the liver and plug it with the embolic plug. So this causes the local action chemotherapy action on the tumor cells and cutting down the vascular supply to the tumor, which makes the tumor shrink. Along with this, we can also do what is called a STARE, that is transarterial radioembolization, where a transarterial radioactive material is injected into the vascular tree, which has a local radiotherapeutic action on the tumor. Both TACE and TARE have shown a very good results in the patients who cannot be a surgical candidates. Apart from this, even systemic chemotherapy can be tried. Once everything has failed, we can start the patient on what is called as target therapy, that is use of a tablet called as sorafenib. The problem with sorafenib and other modalities, systemic modalities, is that the tumor tends to respond only for a short duration, that is around 1 to 2 years, following which the patient develops resistance for the treatment and tumors tend to grow again. To be short, the hepatocellular carcinoma is a poor prognostic malignancy, that is, the tumor has a very aggressive nature, so the treatment is already delayed in a damaged liver, so the end results are poor compared to other modalities of treatment, other organs for cancer therapy. So it is always better to prevent hepatocellular carcinoma. So how can we prevent hepatocellular carcinoma is by maintaining a good liver. That is, to keep our habits clean. That is, not to be alcoholic or consume alcohol or to smoke, preventing which we can prevent the liver damages, and keep non-fatty liver. That is, keep ourselves healthy by good exercises and maintain our sugar levels in a proper way. We can maintain a good liver condition and prevent hepatocellular carcinoma.